Now, one thing you have to read the thoracic cage in three components. In the thoracic cage, now you see in the abdomen or the pelvis, there are always a bony skeleton is there to protect the organs. But thoracic cage has a different place. Different place in the sense your heart is there, your lung is there. Now, so these are soft tissues, structures, organs. Now that has to be protected. So over here, see the thing, the evolution. I told you earlier that the evolution of erect posture, the vertebra and column, and I told you. Now, today I am trying to say you have to integrate with your bones with this skeleton. There are two skeletons, one in the dissection hall and one is here. Now, cervical, the neck region, to see how many cervical, there are 7 vertebra. Thoracic vertebra, 12 vertebra. Lumbar vertebra and your sacrum. Okay. Now, with this introduction, I'll be just telling you and showing you now we are to read ribs today. But without the sternum, it is incomplete. So whatever sternum, whoever has taken your class, or when they will take, that's a different thing. But today I'm just telling you from my experience, you please integrate the total thoracic cage as one. Then it will become very easy. Now, one thing, this is the same sentence, competency-based undergraduate curriculum. Now, this, in our time, then there was no such sentence, competency-based curriculum. Everything is competency-based. But this is a curriculum that is made and accordingly you have to study. I told you in the lecture theatre that your only focus is to pass the examination with 60%. What I am telling you today, you go home, just sit, ponder, and then you just see the distribution of marks. Now, Subramai is taking your exams. Please don't bunk these exams. Up 5 questions, 5 marks you will answer. You go to the hall and just write. Don't be ashamed, because it's a mock test, whatever you say. You will be preparing yourself mentally. What is you are lacking? But if you escape and then you directly go into the final exams, that won't work. 100% it won't work. So never escape a small test or small examination, because every patient you are seeing is a test for you. Every patient. তুমি দেখবে you are complaining of dyspnea. আপাতত এমনি করে কে হলো, এমনি করে আসছে। আবার একজন এমনি করে আসছে। Then the anatomical component is involved. It might be the trachea, it might be your lungs, it might be some trauma, it might be the heart. So you have to quickly 1, 2, 1, 2, 3, 4, 5, 6 tuck, focus. So now identify and describe salient features of sternum, typical rib and typical thoracic vertebra. Identify and describe features of 1st, 2nd, 11th and 12th ribs and 1st and 11th and 12th thoracic vertebra. Chapters include sternum and ribs. Now, introduction. The thoracic cage consists of sternum. This is sternum, 12 pairs of ribs and 12 thoracic vertebra. Thoracic cage protects heart and lungs and helps in the movements of respiration. The function of the thoracic cage is to protect the heart, lung and also respiration. Now, what is the thoracic cage consist of? Sternum, bone. 12 pairs of ribs. Now, the ribs has to be from the vertebral, it has to be fixed with the vertebra. Not fixed, I'm saying, but with ligaments and your different muscles, the thoracic cage is maintained. And always, now you go home, you see your friend's thorax and also you count the ribs, see the sternal notch, see the xiphoid sternum, xiphoid process, এগুলো দেখে নেবে in groups. Okay. Now see the clavicular notch. This is the clavicular here. The clavicular notch, and this is the manubrum, the first vertebra. This is the sternal angle, the second vertebra, third ribs. Sorry. Ribs. First rib, second rib. This is the clavicle. The first rib, second rib, third rib, fourth rib, fifth rib, sixth rib, seventh rib. Now this is the xiphoid process. This is the xiphoid junction. Sternum with the xiphoid process. Okay. Now here's the sternum. This is the xiphoid process. It's missing, but you will see in some bones it is fused, and even sometimes the xiphoid process has a hole. Now sternum, the median bone lies anteriorly in chest wall, elongated flat bone, convex anteriorly and concave posteriorly. Now this is the convex and this is the concave. It is like that. Okay. Now consists of three parts: upper manubrum, middle body and lower xiphoid process. Length 17 centimeters. Now one thing I tell you, if in a tree is a sternum and also the sacrum, the examiner asks you pick up, so please don't tell the sternum as a sacrum or sacrum as a sternum. Many people make this mistake in the examination hall due to nervousness. But if you see that, when you just imagine sternum is here and it's a flat bone, convex, concave, with lateral the articular surfaces for the ribs. And sacrum, pachuca bone here. It's a big bone. It's a big bone like this because it is in the pelvis and it has to accommodate in the female during childbirth plus the pelvic organs. Now that has a different thing. It has anteriorly the foraminals, the sacral foramina. You see it is articulating with the pelvic bone, hip bone. Now this is the ilium and the sacrum, so sacroiliac joint. Over here, sternoclavicular joint. Make out the difference. So, ये हुआ है. वो last 3 batches, many people said, sir, pick up this sacrum. Sternum के sacrum बोलते, sacrum के sternum बोलते. That might be 1 or 2 students. But why 1 or 2 students? Okay? Now, it articulates with the both the clavicle and sternoclavicular joint. 7 pairs of costal cartilage are sternocondral joints. The 7 pairs. This is the portion, sternocondral joints. Now, one thing is that if there is some trauma or some inflammation, there can be acute pain in this sternocondral junction or the cartilages, chondritis, acute chondritis, inflammation of the cartilage. So, and the sternum have highly vascular trabecular bone, performs hemopoietic function even in adults also. Hemopoiesis we have learnt already in physiology. So, that's why sometimes for bone marrow study, sternal puncture. You do a sternal puncture, take a smear and see the type of cells. It is easily accessible. So, a sword, a knife से नहीं, a needle से. Okay? Now, hold the sternum in such a way that it rough convex surface. Now, sternum or sacrum, I am saying it has a convex surface, but this has a concave. The sacrum, and this is sternum. Okay? Now, both manubrium lies superiorly, pointed xiphoid process lies inferiorly. This is the xiphoid process, this is the manubrium. Anterior surface of sternum is slightly inclined forwards. This is the inclined forward. That's an angle, sternal angle. Now features. Now features of sternum consist of 3 parts: manubrium, body, and xiphoid process, also called episternum or manubrium sterni. And quadrilateral in shape. This is quadrilateral in shape, broader above and below. So the sternum, it has the ribs articulating in the lateral borders of the sternum. There are articular facets, and posteriorly the ribs, posteriorly or the vertebra is there. Okay, now see, this is one vertebra, this is another vertebra, thoracic vertebra. This is the intervertebral disc, this is the rib, and this is articulating with the through the cartilage into the sternum. Now, see in the thoracic vertebra, there is an articular surface here, and the rib has two articular surface, and this is the crest separating the two surfaces. Now, you see in this, when you come and see it, is that you can see the upper vertebra, the upper rib portion of the rib is articulating, and next vertebra, the lower part of the rib, with a simple two oval surfaces separated by the crest. Okay? Now, and in this there is a costal groove in the rib. Now, over here, you see this is for the cartilage, and these are the two facets separated by a crest for the corresponding vertebra. It is like this. Okay, and that's the groove, the costal groove. Yeah. This is very more. Now this is the tubercle. Now this is the groove, the vessels, vein, artery, nerve, van, Maruti van. But no more, Maruti van is no more there. It is now, Bachchan ka van ho gaya. I forget the name of that model. Okay? Now, you have to, now these are the intervertebral disc. This is joining, first vertebra, cervical, chotto mete moto, oita, or second vertebra.
Thoracic vertebra.
দুটো নিয়ে আয় Now this is what we are speaking of typical vertebra. Now atypical vertebrae are there. Okay. Now see, ends of the typical ribs, anterior end cup-shaped depression, costochondral junction, joint, costochondral joint. Now head, neck, tubercle surfaces, anterior surface, posterior surface. Now neck is narrow, superior border, crest of the neck. This is the crest of the neck. And superior costotransverse ligament and inferior border internal intercostal membrane. Okay. Now head, upper facet articulation with the higher vertebra, lower facet articulation with the corresponding vertebra. This is the higher vertebra, this is the corresponding vertebra. This articulates here. Okay? And ligaments, capsule of the costovertebral joint, interarticular ligament, radiate ligament. These ligaments are there to hold it in position. Plus, it is the thoracic cage, it can expand by deep insulation. Again, now that will be in the diaphragm, and also your lecture class was done in this thing, your intercostal space ho gaya? Huh? ठीक है. So you just have to correlate this. Now, this is a funnel chest or cobbler's chest or sunken chest. Most common congenital deformity of anterior chest wall, incidence 1 in 500 live births. This deformity, lower end of sternum and lower ribs pushed backwards, decreases in anterior-posterior diameter. Now, pigeon chest. No, vertebral কথা বলছি. না, vertebral নেই. Ribs. First rib or second rib. আমি যাচ্ছি তারা. Okay. See, sternal fracture common in automobile accident, fracture sternum may damage thoracic structures. Ectopia cordis occurs due to non-fusion of sternal plate. This condition, heart lies outside the thoracic cavity. In Facebook, you will see a picture of a girl. The heart, this ectopia cordis. The sternum is not fused. Ossification, there's some defect, congenital abnormality, and the heart is pumping with the membrane. I think many of you might have noticed. Okay. Now ribs, also called rib costa, flat, elongated and curved bones, costal arch, rib and its corresponding costal cartilage form costal arch. Number, there are 12 pairs of ribs, arranged one below the other. 12 pairs. So now intercostal space, this is the intercostal space. In between, intercostal, in between two ribs, the space now placed obliquely, lower ribs more obliquely arranged than upper one. Ninth rib is most obliquely arranged, and below it obliquity gradually decreases. Length increases from first to seventh rib and then gradually decreases. Seventh rib is the longest rib. Now the anterior ends of the ribs attached to the sternum through costal cartilages, except that of 11th and 12th rib. 11th and 12th rib are floating ribs. Now, according to articulation in sternum, classified as true ribs or vertebrosternal ribs, their anterior ends articulate directly with the sternum through costal cartilages. Example, first to seventh pair of ribs. The first to seventh pair. You see from the anterior end articulated with the sternum through the true ribs of vertebrosternal, the vertebral column and the sternum. In between, now the posteriorly in the vertebra it is articulating, and anteriorly with the sternum. Now, false ribs, the anterior ends do not directly articulate with the sternum. Example, 8th and 12th pairs of ribs. Now, there are two types. Vertebrocondyle ribs. Costal cartilage join the costal cartilage of the next higher costal cartilage. Example, 8th, 9th, 10th pairs of ribs. 8th, 9th, 10th. They are known as vertebrocondyle ribs. So, there might be an MCQ, vertebrocondyle ribs. So, 8th, 9th, 10th. Okay. Floating ribs, vertebral ribs, 11th and 12th, 11th and 12th, vertebral ribs. Now, according to morphological features, typical ribs, third to ninth pair of ribs have same general features. Atypical ribs, first, second, third, 12th, 10th, 12th. Now atypical ribs, first, second, 10th, 12th, different features than remaining ribs. Now again, ribs, true ribs, vertebro-sternal, first to seventh. False ribs, vertebro-chondral ribs, 8th, 9th, 10th ribs. Floating ribs, vertebral, 11th and 12th. So 8th, 9th, 10th ribs and 11th, 12th. These are the false ribs. Now one is vertebro-chondral. That means vertebra with your 8th, 9th, 10th ribs and floating ribs, vertebral, the costochondral junction, vertebral with the your 11th floating ribs is 11th, 12th ribs. Typical, 3rd to 9th. Typical rib, 3rd to 9th. Atypical, 1st, 2nd, 10th, 11th, 12th. Now, you can see here, this is the diagram which I drew here. The posterior end, this is the neck portion, and this is the head, this is the tubercle, the neck. Now, it articulates with one vertebra and next corresponding vertebra here. And see, the internal surface is concave and the external surface, the shaft and this thing is convex. The anterior end, and this is the costal groove. This is the costal groove, anterior end. This is the, and see the posterior aspect, the upper smaller facet. This is the head as a whole, crest, lower large facet. This is the medial articular and lower non-articular part, tubercle, with the tubercle. Now, you see, hold rib in such a way that anterior end has a concave depression. Now, when you, the concave, there is a depression here. That is with the cartilage. And you hold it like this. Like this. So, you have to integrate with this booth. Okay? It is on the, if you ask to hold a rib, then you see two facets. That means typical rib, the anteriorly it is oval and for the cartilage, that is with this costochondral junction, and the two facets, they are the upper vertebra and the corresponding vertebra lower, and you have to like this. This. In the body, you cannot see that tilt like that as such, with muscles and everything is there. But with this you can see. Now, the convexity directed towards side of the rib, tilt rib, so posterior lies a higher level, anterior. Now, this is the posterior, this is the anatomical position. This is left side. If I hold this rib, left-sided rib, is like this. It cannot be like this, because my vertebra is here. So if I try to accommodate this like this, but if I hold it like this and they like this, but the costal groove, costal below. Clear হয়ে গেল? Right, left, and so the costal groove is always at below, and see it will be like this. See again at a repetition. Here the costal group, the ridge, floor of the costal group, inferior border. देखो 10 नंबर है skeletal. So head, neck, means your axial skeleton naturally and your cranial bones. So 10 marks. We don't ask you 10 bones. We won't ask. We won't ask sphenoid. If I ask you sphenoid, then I won't ask you on temporal. When sphenoid, temporal, maxilla, mandible, ethmoid, all these bones are cranial bones. Now we won't pertain, or the examiner won't pertain to one question, or one only focusing for 10 marks, I'm saying. Now that will be distributed. So if you take it, say the upper limb, the lower limb, the articulated hand, the articulated foot. So you don't panic. You hold the femur for say lower limb, or if you are asked to hold the tibia, hold it in anatomical position. That gives you say 1 mark. Dhodle, they bolo, this is femur, this is head, this is neck, this is the greater trochanter, lesser trochanter, upper end. Now the shaft is on the, it's convex, and the lower part is the condyle, which forms what joint, I'll ask you. So it forms the, with the tibia upper end, it forms the knee joint. So need not panic, identify the wound and, and see and tell. मुंह से कुछ बोलो ऐसे. But see what happens. Now you have read mandible. Last board chatte. Last flipping over. You see, you have read mandible. So I give you a choice. Pick up which you read in the late night or early morning. Pick up. I won't be the examiner. But just see. Then you pick up your own choice. So aapka mamla hai. So when you think, shut, think, and say, now you want the typical rib or atypical rib. So you bolo dilo, tumi bolo typical rib. You pick up. Now you just say side determination. Now you see the costal group. Lower, inferior. Now the posterior portion, the head, neck, tubercle, the crest, 2 facets. It articulates with vertebra. Which vertebra? Cervical. No. Thoracic. Clear? Now similarly, when you go now you see this is the costal angle. Now I told you that you have to hold it in like this, angulation. The left side, right side, side determination done. Similarly, एक number, करके 8 जोड़ दिया. Now this is the picture how these inferior costotransverse ligament. Now superior costotransverse ligament, lateral costotransverse ligament, costo, and this is the transverse process of the vertebra. Costo, rib, and the transverse process of the vertebra. So that ligament which is attached, according to their position, you have to, this is the anterior longitudinal ligament. You will see in the dissected body. Now tubercle, shaft, see the This is the parietal visceral pleura, this is the lung, and this is the endothoracic fascia. This is the posterior intercostal vessels and nerves, the collateral branches, and see the external intercostal muscle. It's in this direction, the muscle fibers are like this, and internal intercostal muscles in this thing. Because it's a muscle of respiration, it has to, you'll be reading bucket handle movement and all this. So the nature is such that it is in these two different directions. So it can go like that. Okay? Now superior border thick and round has outer inner lip. External intercostal muscle, I'm just running through. Now, this is the first rib. This is the head, neck, tubercle, groove for the subclavian artery, sclerotic tubercle, groove for the subclavian vein, inner border, outer border, costal cartilage. Now, what is happening is that okay. এই আর একটা ছোট ছিল না এর থেকে ছোট এইরকম বিস্তারা ছেড়ে দে now next day I will you just remind me, I will show you. It is not in the tray, I think it is in the thing, but I am telling you now what questions may come in your viva. You have to identify head, neck, tubercle. Now groove. Now the examiner might ask you, what are the relation on the rib from posterior to anterior? They won't tell you posterior to anterior. What is the relation on the rib? So you identify the head tubercle and the sclerotic tubercle. Now, अगर इसको उल्टा देते तो ये tubercle is not visible. I will show you next class. I will talk that, and the next demonstration I will be doing. Now, what I want to say is that it can come as a question, 5 marks. Written question aa sakta hai. And also now this is the groove for subclavian artery, sclerotic tubercle, this is the tubercle, groove for the subclavian vein. Now from anterior to posterior or posterior to anterior, whichever you feel comfortable, you see artery, sclerotic tubercle, the groove for subclavian vein, the inner border and outer border. Now this you practice. Now what I want to say, you in your textbook you will see a very beautiful picture. Any textbook, any atlas depicting now, see, this is a tubercle. Now you draw an artery like this. Anyway, okay, vein should be blue. Now group for the subclavian vein. Now this, just to draw like this, two figure, and you label artery, then sclerotypical, separate the rib, group for the subclavian artery, then group for the subclavian vein. This is the inner border, the flat inner border. Now, this is the second rib. This is the second rib of the right side. But I'm just saying it is like this. It's flat, but short with the tubercle. Now, this is a common question. So you draw like this. Artery, tubercle, this is the subclavian artery and subclavian vein. And you see the picture of the thoracic inlet in an atlas or in the thing. Even it will be shown in your dissection. দেখে নেবে একবার করে প্রচুর অনেকক্ষণ পড়ে থাকে একবার দেখে নেবে. This is the last time you will be coming to anatomy. আর জিন্দেগিতে আসবে না আমার মতো গাধা হলে অ্যানাটমিতে আসে. কিন্তু I have romance for anatomy. Now, features of the first rib. This is the, so you can, I will give you a test next day. First rib, second rib, आपको दे देंगे, तो आप identify करेंगे कैसे करेंगे. Next week, I'm coming, मेला खेला में हम भी जाएंगे. Okay, now, now posterior end, anteriorly, the anterior neck of the first rib is related from medial to lateral sympathetic chain, first posterior intercostal vein, superior intercostal artery, ventral ramus of the first thoracic nerve. Sympathy provides supervision. Now this is a mnemonics to remember. Now sympathetic chain, sympathy provides superior vision. Does sympathy provides superior vision? I am sympathetic to you. That means that you are having a superior vision. Okay, just a mnemonics to remember. And posterior end, see, it is the tubercle, large, coincides with the posterior angle of the rib. This is the posterior angle of the rib, has only articular part articulates with the transverse process of the first thoracic vertebra. This is one single articular. You see it here and see that with the first thoracic vertebra, body is only single. In the previous, and articulates with the transverse process of the first thoracic vertebra, lateral costotransverse ligament attached to tubercle. This. See, this is the diagram. Now, your book, Diljit Singh or Arijit Singh or Indrabir Singh or Bisram Singh, Jidda bhi Singh hai, but they don't have these horns. Only among these Singh, of course, Arijit is putting a small scarf and as a pagdi, but Dalar Mehndi, Diljit Singh, all these people are wearing pagdi. Okay, now just to give you a spell of relaxation by speaking bakwas. Now you see what I want to stress and impress. Whenever you are studying, it might be your osteology. Osteology, the bone dekhna hai khali. What I want to say that তোমরা যদি ঘুমিয়ে যাও তো একটা হবেই fatigue মানে tiredness, and you have to study after 10. প্রথমে फिजियोलॉजी बायोकेमिस्ट्री रट लो, जो करना है खाता करना है, खत्म करो। 10 से 12 मैक्सिमम 1। और नेटफ्लिक्स बीच में देखेंगे, स्क्रॉल करेंगे, फेसबुक, इंस्टाग्राम, है तो you please these you see, मजा ले रहा है, you see, but you start practicing. Just diagram, put it, level, level, level. At least blank script you don't keep. একটা ছবি এঁকে দিলে মানে you have means a picture, a photograph speaks 1,000 words. A photograph of only the portrait of a face, the eyes can speak. What this is relating to. Similarly, what I'm telling you, this gets impressed, embossed. Embossed, I'm saying. I have made this as a practice. Whenever I see a patient, I draw some diagrams and also do flow sheet. Similarly, if you just draw these pictures, at least whatever you can remember, at least over here it has 5 marks, say. Now, if this shaft, the relation, now scalenus medius, scalenus serratus anterior. Now this is the subclavian artery, this subclavian vein. This scalenus anterior muscle. This is the costoclavicular ligament and subclavius muscle. Now this is a picture you should remember for your short note or in your viva. Now what I want to say is that, see, sympathetic trunk, first intercostal vein, superior intercostal artery, the ventral rami of thoracic nerve, this, lower trunk of brachial plexus. Now we have read brachial plexus. Now you see where it is coming. So if there is a accident, the first rib gets fractured and the nerve is injured, the patient will be complaining of some pain or some deformity or the movement of the muscles. So see, you think of the body, this, and all the sympathetic chain, blood vessels, the nerves coming in the intercostal spaces. So this frame of mind you have to pick up. रट लेना भूल जाएगा. Now you see this is scalenus muscle, and again this is the picture. Now this is the second rib. Now the muscles, you see any atlas, তোমার serratus muscles, like this. তার মধ্যে থেকে intercostal muscles are intergenerating fibers are going inside like this. So it is being attached on the ribs, this part. So similarly, you now last 3 ribs, see the muscles, latissimus dorsi, external oblique, then this erector spinae, these are the muscles, levator costae, serratus posterior, inferior, this is the muscle. Now the internal costal quadratus lumborum is the diaphragm originates from the anterior inner end of the inner surface. Upper border, external intercostal, internal intercostal originates from the upper border. Lumbocostal ligament extends from the head of the 12th rib to transverse versus of L1 vertebra. Now to lateral arcuate ligament extends from middle part of the lower border of the tip of the transverse process of L1 vertebra, middle layer of thoracolumbar fascia. Important inner surface. Inner surface is related to costodiaphragmatic recess. Oblique line on middle part of the inner surface marks the line of pleural reflection. Now, Now, this is the rib I have cut. Now you can see this angulation. This is the costodiaphragmatic. This is the diaphragm. Now recess this angle. This is the recess. This is recess. This is the recess, this part. In your radiology, you will be given a plate and showing the costodiaphragmatic recess, the importance of costodiaphragmatic recess. Now, you will be seeing that your any injury, there is a fracture of the rib, or any pneumonitis, pleuritis, it can be of any infective origin, or your empyema lung, then hemothorax, blood in the thoracic cavity. Now that most dependent part of the body, it will, in the thoracic cage is the costodiaphragmatic recess. The fluid collects in this recess. So if you might get a case now. Your collection is so much massive. The left thoracic cavity is full. The costodiaphragmatic recess is all full, and there is a mediastinal shift, and there is severe dyspnea due to the pathological condition. Now, if there is fluid collection, then you have to drain it. And if there is some minor collections like this, minor, a patient comes with a little bit of dyspnea and respiratory disorder, then you order for a chest radiograph, PA view, posterior anterior view. Now, you will see that this costodiaphragmatic recess, there is a line filled up. So it is and then you do whatever clinical examination, and the sound, then you have to send the fluid for examination, your examination, microscopical, biochemical, and if you want to see also for malignancy, then papnicular stain, pap smear. Now this is stitch of the sweater, okay, in the mid-axillary line. Now you just go to your diaphragmatic recess. The bony you count and then you place. And you just, in this part, you put a needle, syringe, and drain. And send that for examination. You will be doing this when you are an intern. गीतांजलि कॉम्प्लेक्स में अच्छा फिल्म आ गया, दोपहर को बंक कर लिया, नहीं, you tap and come. Don't think of scopy, bronchoscopy, can, tan. This is the thing, clinical, this thing. You have to put a needle, get it done, your hematological examination, your radiological examination. Then after these things you can accumulate, then if you need, you go for a CT. दापे दापे पहले नमक तेल में डाल के मटन नहीं डालते, तो पहले CT MRI मत करो. You please inject this in your head. Okay? Now, this is an important thing, cervical rib. Now, there might be a patient with a complaint of neck pain and your little bit of movement restriction and severe. Now, this lies at the root of the neck. Incidence found in about 0.5 to 2% individual. Embryological basis, elongated costal element of the C7 vertebra. C7 vertebra. The costal element may be unilateral or bilateral, may have free pointed tip, or its tip may be fused with the first rib. Okay. Effects. Now, may compress lower trunk of brachial plexus and subclavian artery. So, pain along the medial side of the forearm and hand, wasting of intrinsic muscles of the hand. Now, intrinsic muscles of the hand. Now, if patient comes with pain and your medial side of the forearm, wasting of intrinsic muscles of the hand. So, think and severe pain, neck pain, you do a just simple radiograph of the cervical spine and also a thorax. And then you correlate, you see that is this cervical rib, and the patient is complaining of pain, and then you see for it a kotodin theke hoyeche. So you might be just a few days, I'm thinking that there might be no means visualization, you cannot see the wasting. Wasting it takes a long time due to the neural compression and pressure. But if it comes, then you think in this line, don't neglect that it might be a cervical rib. Now, rib fractures, angle of the rib, weakest area of the rib, commonest site of fracture. Fractured rib may damage pleura, lungs, liver, spleen, diaphragm, and so on. Lumbar rib, also called gorilla rib, develops from the costal element of lumbar 1 vertebra. So we are gorillas. We came from this thing. Okay. Now, this is important. When a patient comes into the emergency and with road RTA of fall from any height, it might be a small, just few feet. It's not from Talgaj. You know Talgaj? Hostel থেকে you look east, west, north, south is this. Okay, you just দাঁড়িয়ে আছে. It's a variety of palm where you get a fruit and that has a pulp, and we in Bengal make puris, pakoras, sweetened pakoras and puris, fried in mustard oil. It's a very thing to taste. You have not tasted, I think. ठीक है, आप मुझे याद करा देना. Okay, and now, now what I'm telling you, so at the angle of the rib, you just put gentle pressure. Hey. Now, you just take like this, aste aste. Yeah, see if it is the angle there. Okay, so whatever, then you see, X-ray करा लिया, जो भी है, लेकिन what you have to do is that you have to give, you cannot put a big plaster, but there are some bandages, splints and everything is there. But one of the most commonest in the emergency you can do is that you take a 4 inches Dynaplast. This is a elastic bandage, like crepe bandage, that is, paste is there, Dynaplast. Okay, you take it from this portion of the vertebra, now this side is injured. Then you take, सांस ने expand. You put that strap like this and then you bring it around tight, and in the sternum you put a bandage. Then it gives rest. It feels bit better. You give analgesics, antibiotics, and then you can send it. You say you want to immediately, you send it to the radiology department. He'll be attended in it will take some time. So you give a palliative, at least the treatment you are giving, you give a support, rest, and rest means it will be in this thing, and also analgesic, antibiotics and this thing. Then you get the plate, you confirm your diagnosis, then at least you don't, and of course, if there is some collection, that patient has to be admitted and kept for observation. If he's and put in oxygen, of course, you have nowadays your pulse oximeter or something like that, but also if it is in the using, I would rather say this type of chest injuries should be admitted and supervised for any development at least for 72 hours. Because the fluid might be slow collection. That might be immediately after trauma they are brought to you. Within 12 hours that deteriorates patient. So you have to have a keen observation on this type of patient and see the fractured rib is a very common thing. It might not be very severe, but that little bit of injury will, there will be blood or fluid, then there will be pleuritis. That also leads to inflammation, and then there will be some collection in the thing. In trauma, but in tuberculosis or any pathological condition, that management is a bit different. But if you see that You observe, and then in the indoor you just take a syringe. এগুলো পেশেন্ট পার্টির সামনে সেই একবারে লোক ডাক্তারবাবু কিছু হচ্ছে না, ও এই করছে, হ্যাঁ, নো কিপ কুল, সই করো, অ্যাডমিশন দাও, ঢুকিয়ে দাও, নাকে নল টল ভরে দাও, অক্সিজেন দিয়ে দাও, হ্যাঁ, and then you attend to that patient. So the commonest site of rib fracture is in the your angle of the rib, weakest area of the rib. It is the weakest area of the rib. So with this, next you just একবার दर्शन कर लो ऐसे देख के घर जाओ, again read, and next you have any queries, you please see the how, you just see and go, that the vertebral articulation with the rib, and the first rib and second rib, you see the important your brachial plexus, the subclavian artery, subclavian vein, muscles, that these two pictures you memorize, draw today. It will take you 1 hour to see typical, atypical ribs. You draw diagrams, finish it. Keep it in the, for incubation. You know the incubator, but not our human incubator. It's the chick incubator. So you keep it in the incubator and it will give you chickens.